Hello, everyone, and welcome back to the Natural PCOS podcast. I'm your host, Dr. Samina Mitha, and today we're talking about a near and dear topic is hirsutism. This is that unwanted hair growth in PCOS. I think I can talk about this probably all day long, especially my personal story, because hirsutism was probably one of the first things that I experienced as a teenager when being diagnosed with PCOS, looking back and being like, okay, yeah, that made a lot of sense. Why I was waxing my face almost every 2 weeks. I didn't think that was normal, but I also thought that maybe it was just my ethnicity, my background. But it didn't really make sense if you think about it because my sister didn't have any of those issues. So it's something that is super annoying if you are dealing with hirsutism right now. I completely understand where you're coming from. And today I'm going to walk through what you can do and the science behind hirsutism and what's actually happening. Can be extremely stubborn. These hairs even grow back after, do waxing or laser hair removal. I have patients come in and say they did laser, but the hair just came back and they shave every 2 to 3 days and the hair has become very coarse over time and it's spreading. Not only is it now on my chin, but it's on my neck, it's on my chest, it's on my back, it's on my abdomen, it's on my butt. And there's this scoring mechanism or chart that you can use, Ferry-Galloway. And this actually is a score for hirsutism. It shows different parts of the bodies and the amount of hair in each, and then it can kind of give you a score as to like how bad it is. What's really annoying is that these hair removal techniques, especially waxing and shaving, they can cause ingrown hairs. And first of all, women with PCOS are already susceptible to ingrown hairs. Now they have to remove the hair, and now they're even more experiencing these ingrown hairs. I remember when I was a teenager, I had too much hair. First of all, everywhere, but mostly on my upper lip. It bothered me so much. I remember my mom used to help me bleach it because it was so dark. And, it definitely helped to make it look not as intense, but it still was there. It was so bad. And then I moved on to waxing and I was doing that a lot, threading. I even taught myself how to thread my eyebrows. Or sorry, not my eyebrows, definitely not my eyebrows. I've had really bad dreams about accidentally threading my eyebrows off or waxing them off by accident, and that's like super scary for me. But I had learned how to thread my upper lip by myself, which is actually pretty easy. So if you want to learn, you should just YouTube that. And then when I got engaged, I was like, okay, this is the time I'm gonna, do laser. And I did laser on my upper lip, my underarms, and I think that was pretty much it. And luckily, it actually worked for me. The hair is definitely back, but not as coarse, not as intense, and I don't have to thread. I usually just shave every like a week or so. So that's actually not too bad. When I'm talking about hirsutism with my patients, what I'll tell them is the goal is to reduce the frequency at which you have to deal with it. It might not go away altogether, but if we can reduce the speed at which the hair is growing, that is actually really, really helpful when it comes to hirsutism. Now, one thing I want to note here is that there's a huge science background to hirsutism and how it starts. It all starts from puberty. So what happens in puberty is androgens actually affect that hair follicle. When your body is exposed to androgens in puberty, the hair follicle turns into something called a terminal hair. So in childhood, you grow up with something called a vellus hair. This is hairs the follicle creates hair that's thin, not coarse, thick. And then when you're exposed to androgens in puberty, it becomes a terminal hair. So that terminal hair is extremely coarse, and what happens is the more your body is exposed to testosterone, the more androgen receptors there are, the more testosterone really impacts the hair follicle and causes more androgen receptors to be expressed, especially if you have PCOS, you have insulin resistance. Those things can actually cause more androgen receptors to be expressed and keep that terminal hair follicle around even more so. And eventually, chronically over time, if that follicle is exposed to androgens and it stays in that terminal hair follicle stage, it can completely permanently change into a terminal hair follicle. It's called terminalization, basically, from vellus to terminal hair follicle, which is actually very annoying. So yeah, those patients who are coming and saying that they went to do, any type of treatment and still their hair is coarse and thick, it's probably because that follicle has been exposed to so much testosterone over time that it's basically permanently become a terminal hair follicle. There's so many factors and variables that go into this. Insulin resistance is definitely number one factor that can cause, those coarse hairs. Enzymes in the hair follicle, so something called 5-alpha reductase, this converts testosterone to DHT. This is dihydrotestosterone, our more potent type of testosterone, and that can also really impact how coarse that hair is, because DHT is extremely potent testosterone. Levels of our hormones like estrogen and progesterone can also affect it. And what's really interesting is as we age, we actually don't always see a decline in testosterone in terms of hirsutism. Acne might get better, ovulation might, come more frequently, but in terms of hirsutism, it really doesn't change, which, is super difficult to deal with. And the other thing to think about is after menopause, your estrogen and your progesterone decline, but your testosterone kind of remains in that system. And maybe some symptoms of testosterone get better, but definitely hirsutism can stick around. So how do you treat this very stubborn hair that just keeps popping up everywhere? What's really annoying is, that hair in the stomach too. I don't know if you experienced that, but just even hair on the legs. I used to have hair, or I definitely still have this, is hair on my toes. That's super annoying. And arms, one thing that I used to do is actually wax my arms by myself at home, which was actually really easy, but it's super messy. So women with PCOS actually told me about this thing called an epilator, and an epilator has actually been a game-changing thing in terms of my hair loss treatment at home. And I can use, it looks like a electric shaver, but it has hundreds of little tiny tweezers, and what it does is it just like kind of plucks at the hair as you move the electric shaver along your skin. And I found that that's actually been extremely helpful. There's no mess really with it. I mean, hair goes everywhere in the chamber, but you can take it out, and it's not as intense as waxing. So if you're looking for something at home, an epilator works really well. I haven't tried IPL treatment at home. That's probably my next thing to, try. But when it comes to really treating insulin resistance, what we're trying to do is a two-prong approach. We're trying to treat it externally, so we may need to use something like waxing, shaving, laser, electrolysis, an epilator, an IPL device, something. And we're treating the inside as well. Majority of the time, we're treating insulin resistance, because the more insulin in the bloodstream, it actually causes the ovaries to make more insulin, and more insulin actually reduces sex hormone binding globulin. This is a little globulin. It's great. What you want to do is increase sex hormone binding globulin. You don't want it to be low. What this does is it binds up all the free testosterone and reduces all the testosterone symptoms. So how do you increase sex hormone binding globulin? You reduce insulin. That's how you treat it. Another thing that we know is high triglycerides can actually increase DHT, dihydrotestosterone. So if you've been told you have fatty liver, this could be because the triglycerides are high in your bloodstream and also through ultrasound. But what you really want to focus in on is bringing the triglycerides down. And how you do that is you also treat insulin resistance. So how do you treat insulin resistance? Diet is probably the number one thing that you need to focus on. More protein, lots of healthy fats, lots of fiber, vegetables, maybe reducing your carbohydrate intake if you're taking too much in. No sugar. Bring the sugar out of your diet. It's going to make a huge difference in your hirsutism. And exercise, movement. So high intensity interval training has been studied for this. Working with a practitioner to help you determine what kind of exercise is important. Even just walking, that pumping action of the muscles when you walk actually helps to get glucose inside the cell. The more muscle you build, the more storage for glucose. And so that in itself is going to improve the insulin resistance. Building muscle, walking, all these things can be helpful. And then supplements, right? Inositol, berberine, N-acetylcysteine. These have been really helpful. Omega-3 and vitamin D. If you're looking specifically for things to reduce testosterone, so anti-androgen agents, things like spearmint has been studied. It was a very small study. I think it was 42 people. They drank 2 cups a day. And what they found was their hirsutism got better. My patients do come back and tell me that this works. I have also tried this as well, and I do feel like it works. And inositol also really helps to reduce insulin and testosterone. And, a herb that commonly we know and we've studied in school is saw palmetto. This prevents the conversion from testosterone to DHT, our dihydrotestosterone, that more potent form of testosterone. Zinc also reduces conversion. White peony, licorice, reishi mushroom, EGCG, green tea extract, really helpful. Also nettle and omega-3s. So there's so many different things to try. It's really about figuring out what's the cause of your hirsutism. Maybe it is insulin resistance. Maybe it's, testosterone coming from another area that you need to focus your attention on. Another treatment option is bioidentical progesterone. What it really does is it helps to lower LH and DHT. So LH is that luteinizing hormone. It comes from the pituitary gland in the brain, tells the ovaries to make testosterone. It helps with ovulation. So the more you're ovulating, the less testosterone you'll build. And just in general, progesterone is great at reducing testosterone. I've had patients come back and say, my hair has stopped falling out as much when I started the progesterone, or my skin is better, or my hirsutism is getting better. So this one, you need a healthcare practitioner to prescribe. It has to be taken cyclically in your cycle. Usually in a suppository form is what we commonly use. You can use an oral-based form of progesterone as well. And then conventional treatment options that are commonly prescribed are things like spironolactone and birth control pills, which definitely help downregulate testosterone. But sometimes it's just not enough, because sometimes when patients come off the birth control, their testosterone goes back to where it was. So you still really want to figure out what the actual cause is. When we think about prevention of hirsutism, what I would strongly suggest is, if you have a family history of PCOS, or you have daughters and you're trying to think of what if they could have PCOS, and you have a family history of PCOS, maybe an aunt, a grandma, your mom, somebody, anyone, I would really start to think about that in puberty and try to work on it at that point. Because I feel like at puberty, you're eating lots of sugar, So if we can try to limit that and really increase our healthy fats, it's going to be much better in protein. And then one thing I would also consider is looking at your dad's family history and your dad himself. Does he have something like a male pattern hair loss, or did he suffer from acne as a teenager as well? Does he have benign prostate hyperplasia, which is because of high levels of DHT, right? And if dad has that, the daughters that he is going to have could also have an increased risk of PCOS. So lots of things to think about when it comes to hirsutism and PCOS. I hope this kind of gives you an idea of the science behind it and how to treat it, and helps you to feel a little bit like, yeah, okay, this is a thing that I'm going to have if I have PCOS, and this is how I can really maybe work on treating it and reducing it. Thanks again for joining me, everyone, and I'll see you in the next podcast. Bye.